Welcome to another episode of Point of Care Ultrasound Education on the POCUS Club channel. Thank you for tuning in. Over this series, I have a special guest joining me in our mission to teach Point of Care Ultrasound to clinicians who look after patients and would like to use the best possible bedside tool to help diagnose and treat their patients. Dr. Peter Weimersheimer is joining us. For these few episodes, Peter has worked as an emergency physician looking after the people of Vermont and has recently joined Butterfly as the Vice President of Clinical Integration. Peter was one of my supervisors on the Ultrasound Leadership Academy Fellowship, and I consider him one of my mentors and a friend. Today, we are going to remotely teach the Royal College of Surgeons of Ireland's Sonogame's team how to do the eFAST exam. We are going to do this entirely remotely. Peter is casting in from the wilds of Vermont, and I am in my kitchen. This will be split into episodes for each of the locations that you will scan in an eFAST exam: the right upper quadrant, the pelvis, the left upper quadrant, and the subxiphoid area. The lung component I have already covered in previous episodes, and you can watch them over here. If you are interested in teaching remotely, observe the language that we use to describe probe movements. This is especially so even if you are teaching at a live course. Maximize the amount of probe time for your learners. I hope that you will be able to use this both to troubleshoot your own images and when teaching your colleagues the eFAST examination.
Yeah, that would be great. Thanks, guys. It's actually the sunniest day in Ireland today.
Yeah, it's actually quite sunny down here too.
Yeah. Yeah. Okay. So right now I'm having a right upper quadrant view.
Perfect.
I'm seeing the liver.
Mm-hmm.
I'm seeing good margins there. I'm going for the tail,
Okay.
and I'm happy with that.
Mm-hmm. Now, are you in the right space actually? Because what's all this stuff here?
Oh, sorry.
You see all this here?
Yeah.
Like, why is it all so fluffy? Usually you'd expect the kidney, wouldn't you?
Yeah.
Yeah, there you go. So what you, if you can bring the iPad back so I can see the tail of the probe, so I can just kind of like give you some direction as well. If someone else will hold the iPad for you, that would be great.
Yeah.
So what is happening here is if you tilt the probe, just show me the tail of the probe again. I need to see the wire almost. Yeah, there we go. So if you tilt the probe tail up, you'll start to see the kidney. Okay.
Can you hold it like a bit? Yeah.
Yeah, there you go.
Yeah, there we go.
Okay. So that's your Morrison's pouch. That's your kidney.
Yep.
And then after that, you can move your probe. You can slide your probe down a little bit to kind of look for the caudal tip of the liver then. Yeah, there you go. And you're fanning through it. So you need to fan each time you are doing this. Yeah, exactly. So you want to fan through the tip of the liver because it's a 3D structure.
Mm-hmm.
So good job.
Mm-hmm.
Okay. So you happy to call the eFAST?
So I'm happy.
Or
with
happy
this
to call the
quadrant.
right upper quadrant? Excuse me.
Yeah, I'm happy with the right upper quadrant.
Okay. Have you shown me the area above the diaphragm?
So, sorry, let me just get some gel here.
Katrina, you wouldn't mind just to bring the iPad back a little bit? Maybe if someone else would be able to help you hold the iPad?
Yeah, I have someone holding it.
Oh, okay.
But I'm trying to also see the iPad at the same time.
Ah, okay.
So I think we're making it work here.
Cool.
Okay, so kidney.
Yeah, perfect. Okay, so, and then you want to move a little bit more superior, as in this direction.
Oh, that's so much better. Oh, thank you. Okay.
Thank you.
So I'm moving this way.
Yeah. Okay. So now what happens is you want to clear the area above the diaphragm is what I'm getting at. So the thoracic space. So you want to make sure that there's no fluid up here.
Sorry guys, I'm having trouble hearing. Okay, so I'm having trouble actually visualizing.
Okay.
So I think I'm seeing spine there.
Yeah, you have spine down here.
Yeah.
And it kind of stops at the costophrenic angle. Yeah, exactly. Yeah. So you can be quite happy that there's nothing further up in this kind of area.
Perfect.
Okay. So then can you call it, so you want to see the Morrison's pouch, you go down the caudal tip of the liver, and then after that you go up to the thoracic space, and you kind of, yes, exactly. You do that to make sure that you don't have any free fluid at all.
Yeah. Okay. Perfect.
Perfect. Excellent. So you want to go on to the next area?
I just move on to do kind of the abdomen where I start in the right upper quadrant?
Absolutely. So in an adult, the most sensitive place for blood is going to be right upper quadrant.
Okay.
It's a little more variable for kids. Sweet, right? What are you seeing there? Give me give me some pictures. So what's this white thing?
So it's the diaphragm, and
awesome.
then
so what's to the left of diaphragm?
So that should be lungs above it.
Right. And so what's this white thing over here? See if you can hold that. So one thing, you see how you're holding your hand?
Mm-hmm.
You take your hand and actually touch skin. Slide your hand so there's pressure against Greg's chest. Contact. See, now you can stabilize that transducer. And I actually will often flip my hand over. You can pick whatever ergonomics you want, but when you're holding a transducer, especially on the side of somebody's body and it's in midair, it's just going to slide. And you're going to say, damn it, I had a great picture. Now it sucks. Oh, this is being recorded. You didn't hear me say that. Okay. All right. So go ahead. You had a fantastic view. So I think you want to slide a little bit this way, a little bit back up.
Okay, back up.
And then see if we can find that kidney again. There. Sweet. Right. So now this is beautiful, right? Because here's that diaphragm, and here's this white. What's this white over here?
The spine.
Exactly. So what happens when Greg breathes? What happens to that spine?
It should move down.
It goes away, right?
Yeah.
Because this is all full of air, and because air doesn't conduct sound-wise, every time lung goes over anything else in tissue, it obliterates that tissue. So right away with this scan, this is like the trifecta. You're seeing that there's a diaphragm here and spine, and there's no fluid in the lung because that disappears. You're seeing liver here, and this space between liver and kidney is what?
Morrison's pouch.
Great. So there's nothing in Morrison's pouch, and there's the kidney. So is this an adequate study to say that there's no blood in the belly?
No, we probably want to still look at the caudal head of the liver.
Oh my gosh, you guys are so good. Yeah. So you want to slide your hand down, slide down towards the feet.
So I just go this way, right? Okay.
Exactly.
Goop up. Goop up. I'll take all the goop with me. Okay.
There you go. There's caudal liver right there.
There's a little bit of a glare, so it's hard to see. Oh, okay.
Right.
Yeah.
So I'm going to do something else with you. So I want you to slide back up over here.
Okay.
And I want you to take your transducer and actually slide it up a little bit more anterior on the chest and look downwards. There you go. Get that angle down. And I'm going to give you a little more gain here.
Yeah. Okay. There we go.
And just mess around a little bit. See if you can get that diaphragm and spleen this way. Diaphragm and kidney. Sorry, I'm speaking English. There you go. So what I like about the view, I like to be about 10 o'clock. If you think about the chest as a barrel, I like to be about 10 o'clock up here versus axillary looking down, because in theory, right, your sensitivity increases when you're looking at a gravity-dependent area. So now you're really looking downward towards the spine. So again, you see the diaphragm, you see the spine, the lung is here. And now go ahead and slide again towards the feet a little bit more.
Okay.
And here you get a better view of the interface at Morrison's pouch and that caudal liver. So slide a little more. You want to get that caudal liver tip. Right, so I like to be a little more. I like to be a little more anterior and use plenty of gel. These transducers need a lot of gel. So yeah.
Last week Greg was covered.
That's fine.
Yeah, just pour it on his chest. You don't need to pour it on a transducer. It's inefficient.
Bladder.
Right? This is trauma, man. You don't have to worry about that. So he's a trauma patient. All right. So again, you see this. What you're seeing here is some air artifact right up here. You need more gel there. You don't have enough gel. So just pour it on his chest.
Always more.
Oh, there we go. Look at that.
Oh, there. That is that. Damn, that is a glob.
All right.
Yeah, and remember that anytime you feel like you're not getting a great image, think about it's pressure and gel. So there's a really sweet image. There's your caudal liver tip. Here's your inferior pole of the kidney. Those are great places for fluid.
Oh, that's
nice. Right, so this is, I like this view when you're a little more anterior along the chest around here because you get to look down, see that, you see that, and you see that at the same time. So great view. And Greg, nice to know you do not have blood in your belly. One thing that's really cool, if you're taking care of a woman who comes in who's hypotensive and atraumatic, whose reproductive age is always a concern about ectopic, you will actually see fluid here in this caudal tip before you'll see it in the pelvis often. So it's really kind of, so I think the idea is that any adult with fluid in the belly for any reason, that's a place that's really sensitive. Okay, so now you want to go to the left side, right? That's a beautiful view, by the way. Great job. Great job.
Again, I'm just going to ask you, how come it looks like his liver is in his chest? What is that actually?
That's it. I'm not sure.
So this is what we call the mirror image artifact. Okay? So the ultrasound comes over here. It comes down in a straight line. Okay. Then it actually reflects and then goes this way. Okay.
Goes to the side.
It goes to the side, because it's like a vector. It's like a angle of incidence. So because it's very highly reflective, so it goes off to the side. After it hits the side, then it goes back to the diaphragm, and then it goes back up to the transducer. But what happens is the transducer doesn't know that the sound traveled this way. It thinks that the sound traveled this way.
Okay.
Right, and that's why what is appearing over here kind of seems to appear over here.
Okay. Yeah.
Okay.
Yeah.
So this is what we call the mirror image artifact. Okay.
Okay.
And you demonstrated that very well. Actually, I don't think anybody actually showed me that before.
Thank you.
Okay. So so we're happy there's nothing in the thorax, no pleural effusion or blood, or no haemothorax. So where do we need to go now?
We should see the tip of the liver and just make sure there's no fusion there.
Yeah. So along the way down, you can have a look at Morrison's pouch as well.
Yeah.
Okay. So that's your liver.
Do I need more gel?
You might, you can see the full lines down here. I give this to you. I don't have enough time.
Thank you. Okay.
Good job. Okay. Excellent. Do you want to decrease the depth a small bit?
I mean, not enough. I would say an FBC.
Yeah, that's perfect. Now, so we're getting a lot of bowel gas here. Okay, you see all this? This is all bowel gas. Okay. And we're not really seeing the kidney. So how do you think we'll be able to see the kidney the
Points up like that?
Point up. I think tail up, probably.
Tail up, yeah.
Okay, and you may need to go a little bit more posterior. I think Thomas had a very big lunch here.
Take it down towards the bed.
Yeah, go more towards the bed. Yeah. Okay, and then there you go. That's kidney starting to come up. So you actually have to go even lower, I suspect.
Yeah.
As in, sorry, not that direction, but towards the bed.
Down.
Yeah. Yeah, there you go. So you can start to see the kidney here. Okay. All right. And as you're going down into the bed, then you tilt the probe tail up.
Tail up, yeah.
Tail up.
Yeah, tail up. Yeah. There you go. You see?
Yeah.
Okay, that's the kidney there, and that's Morrison's pouch there. Okay?
So it's angled that way.
Yeah. And then you fan through this space and make sure that there's no fluid there. Yeah. That's perfect. Excellent. Okay, so there doesn't seem to be any free fluid there. So we want to see, as you rightly said at the start, the caudal tip of the liver.
Yeah. So go down.
Oh, your nose there.
Yeah, there you go. Over here.
Yep. Yeah, perfect.
Okay. Happy enough?
Yes.
Excellent. Good job. Excellent.
Perfect.
Okay.
Yeah.